Welcome to Health and Wellness, Bethany TV for Health. My name is Dorothy. It is a Saturday, beautiful one, a hot one. But guess what? We're always here to issue out matters of health. Today I do have a doctor, and who'll be talking about eye care. Now, a number of people have been, with age, they have talked about how they lose eyesight. We have seen young children lose eyesight, and they wonder what could be the cause. And eye specialists have always continued to look for the right medication or treatment to ensure that everyone's eyesights are kept on check or in check. So today I do have Dr. Erima Dennis, all the way from Rubaga Hospital, and he'll be here to introduce and elaborate more how more we can, which diseases affect our eyesight and how we can prevent them, and how we can be better with our eye treatment as well. Welcome to the show, Doctor.
Thank you very much, Dorothy.
Please introduce yourself once more again.
Thank you. I am Dr. Erima Dennis, as you mentioned. I am an eye specialist. I work at Rubaga Hospital, and I am also the president of the Ophthalmology Society of Uganda. So the word ophthalmology is definitively means eye specialist. So I'm the president of the eye specialists in Uganda. Yes.
Welcome to the show.
Thank you.
Is it your first time to be at Bethany?
Very first time.
Feel at home, feel at home.
Thank you.
Well, usually we have talked about eye care diseases or eye care health. Briefly tell us what diseases affect our eyes.
So, eye diseases are quite many. And to be honest, to become an eye specialist, I had to study these diseases for 3 years. And that doesn't even begin to cover everything. Okay. So there's a lot, and a lot we could talk about. But in the simplest forms, we have diseases that are obviously more common than others. And for me, I usually like to categorize them into two groups. The diseases that cause people to go blind, and the ones that don't cause blindness. And the importance of this is that ultimately, if you do get eye disease, your eye should not lose function, and that means you shouldn't become blind. And our biggest fight the world over is to try as much as possible to reduce blindness or to treat blindness. And almost 60 to 70% of the blindness that exists, especially in our regions, is due to preventable causes or treatable causes. So really there's no need for someone to be or stay blind. So in the category of diseases that cause blindness, we have the first one on the list is cataracts, which most people understand as nsenke in the local term. But of course in various areas and languages it may change. Although I'm more in the central region, I understand it. I usually explain it to people as nsenke.
Is it the one they call the cloud?
Yeah, the cloudiness of the eyes. So what happens in that condition is that the eye has several parts, but we only see the white and black in front.
Yes, true.
But the eye is like a ball. And there's parts that we don't see even when you look at someone's eye. And right inside it, there's a lens, just like you have a lens in a camera.
Okay, yes.
And so that lens over age begins to change from being clear, because when you see a camera lens, it's really clear. So it starts to change and become white. And that means that what you see goes through that whiteness, and that's why it starts to look cloudy. So that people talk about echifu, or you look at something as if there's a curtain that's blocking it. So that's what nsenke is, and it's the most common cause of blindness in Uganda and in most of sub-Saharan Africa.
Oh.
Yes. The second condition is what we call corneal diseases. So cornea, the black part that you'll see in a person's eye, is actually inside. You're looking through another layer of tissue to see the black that is inside, or the gray or the brown, depending on a person's eye color. That eye color, yes, that eye color structure is inside the eye. But you see it because you're looking through a clear substance to begin with. So that clear substance is called the cornea. And because it's at the very front, it is subject to getting injured. And so there are several people who get injuries. So maybe a fly flew and hit that eye, you're on a border and a stone hit, or you were in a bush or walking around and some grass hit your eye.
Yes.
So it gets injured so easily because it's so exposed. You have to look through it to see anyway. So the conditions that affect that part are quite common. And once it gets injured, it usually heals with that scar and you can't see through that scar. So you end up being blind. So it's the second leading cause of blindness in our region.
Okay.
And then the third, now it depends. So these two alternate change places between the second and third. So the third one is a condition called glaucoma.
Glaucoma, okay.
So glaucoma, people have probably heard the word, and these days we're campaigning so hard for it. But glaucoma has been hidden amongst us. And glaucoma is, right now we are trying to define it to people and for them to understand it easily as pressure amaso. Pressure amaso.
Atari pressure w'umubiri. Katono pressure w'amaso.
Yes. So in the simplest term, glaucoma is like pressure, high pressure in the eyes.
Oh, yes. Yes, now I get.
Good. So the eye has water inside that keeps its structure as a ball, and that water is produced and cycled, and sometimes there's a problem between how much is produced and how much is flowing out. So that causes, because it can't, it's not elastic, so that causes pressure to build up inside, and when that happens, there are cells, we call them in our terms, they're cells, but there's waliwo obutafari. I usually tell people the obutafari.
Kata Dr. Chenji badensaba tunyonyole nnyo mu Luganda omuntu wange ategeere oweka mocha tetwogerako wabeerawo obutafari obuli mundo emabega eyo bwe bukwata ekitangala, the ones that receive light. Now with the high pressure it sits and squeezes them and they start to die off. Mutandika okufa. So as they are dying off, it reduces your ability to capture the light that you need to see. Okay? And so slowly by slowly, the eye, its power to see starts to reduce because the cells are dying. Okay.
Now the unfortunate thing about glaucoma is that the cells that die cannot be brought back. So the vision you lose from it cannot be brought back. Okay? So glaucoma is the leading cause of irreversible blindness in the entire world. Okay? So there are some risk factors for all these conditions. I think we can talk about that.
No, before we go, Doctor. This is a new topic.
Okay.
I really wouldn't want to rush it.
Okay.
I want, because you have always talked about pressure, diabetes, and it's usually like the body. Now that the doctors have now started talking about this illness that has come out, which is glaucoma, I mean, we need to, picture a good, give a good picture about this.
Yes.
For someone to understand.
So we have special instruments, and this is the unfortunate thing about glaucoma, that it requires a lot of specialized instruments to be able to detect it.
Okay.
Okay? And the treatment may be a bit straightforward in some ways if it's early, but the biggest problem is detecting it. It requires a lot of specialized equipment, and the thing though is that we've not been having all of that equipment in many places in Uganda. I can tell you that to be able to diagnose the glaucoma accurately, it's mostly centers within Kampala.
Okay.
And we have a site in Masaka, but beyond those areas, it's a bit harder. And you also need a lot of expertise.
Very true.
It would need an eye specialist to be able to
come in.
Because there's a lot of, some gray area between actually finding a person with high pressure and identifying that they have this disease going on. Because remember, the high pressure is the risk for the cells to die.
Yes.
But you may have it and they've not yet died. Okay? So we need we need a lot more to be able to evaluate it. So that's why it's causing a lot of blindness, because it's not being detected fast enough and not soon enough.
But in fact, adding on by the right specialists.
By the right people. And the worst part is that everything about glaucoma is painless.
Wow.
So there's no sign the person will see, they won't feel anything in the eye, just as you see the pressure or mobility. People go to the bathroom in the morning and collapse and they are taken to hospital in a stroke. So it's something similar to that. Yeah, so that is number 3.
Okay.
Number 4 is diabetes. So everyone who has a sugar problem, it tends to cause complications in the eye.
Okay.
Yeah, so especially if the sugar is not managed very well. So, and because the rate of diabetes is rising, in Uganda, then also the rate of its complications is rising
as well.
People, yes.
Okay.
Yeah, so those are the conditions that I could say in summary cause blindness and are quite common. There are others that I will tend to spend the whole time talking.
Okay, because now that you've mentioned about that diabetes as well, pushing to that, what about abakazi b'embuto? We tend to also lose sight once in a while. Is it also part of your talk as well here? Sometimes, sometimes you go to the doctor and like, I no longer see well. Is it because of pregnancy? Is it because of stress? Is it because of, or for it is a different case?
Well, I cannot tell you that there's any condition that has pregnancy directly as a risk factor for eye. So I can't pick an eye disease that is specific for pregnant mothers.
Those are the
myths. That at risk. Yeah.
So now that you've talked about the common, diseases,
and those are the common blinding ones. There's the common non-blinding ones. Could I just mention three?
Please do share.
So the first one in that category, it kind of teeters on the borderline between being blinding sometimes, but most times isn't. It rather causes what we call visual impairment. So you are not blind, but you can't see as clearly as you're supposed to see.
Yes.
And that is what we call refractive errors. And categorically, conditions that require glasses to be treated. Okay, so we call them refractive errors. And that is the long-sightedness, short-sightedness, and then this one where people can't see things close by, which we call presbyopia, which is even the most common of all of them.
Yes.
So once you clock 40 years, it will happen to everyone. There's nearly no exception. There's nearly no exception.
Really?
Yes.
Okay.
So those conditions which require spectacles to treat are so common, and in fact in any eye clinic they account for about 60% of the patients who walk through. They can't see clearly, and all they need are glasses.
The short-sightedness and the
long, yeah, and there's one called astigmatism. So they don't necessarily cause blindness, but they impair your vision, and they are very, very common.
Okay.
Then the second in that category is what we call broadly as conjunctivitis, which basically means, so the eye has like a skin on it, which is called a conjunctiva, and that skin has immune-related components, and it now reacts because it's exposed most of the time. It can react to anything. So when people get the reaction, the eye becomes red, the eye itches, they feel like there's stones inside their eyes, they get tearing.
Yes,
that condition is so common, common, and also brings a lot of people to eye clinics. But it doesn't cause blindness. It doesn't typically cause blindness.
But at least they run to the
because
hospital.
there's pain, people run to hospitals very rare. Whereas the ones that cause blindness, as I mentioned earlier,
they are painless. That's what you said.
Yeah.
So they're hard to detect as well.
Yeah.
Okay.
So conjunctivitis is quite common. And then the third on that list is, you see this part of the eye is called the eyelid,
yes.
the one which moves. It also gets some conditions, it swells in parts, and those swellings are also a bit common, but of course they don't cause blindness, and they can all be treated.
Okay.
Yeah.
While you're still watching Bethany TV for Health, Dorothy is my name. Dr. Dennis is here to talk about eye care. And if you've just joined us, we're talking about some of the common diseases that are detected. And I think the second ones they've talked about are now the most one that people can relate to. But also we have understood that munange waliyo sukari wa maso. Complications za sukari ziletera amaso. Ne pressure ya maso. So that one also has been discussed as well. But now the doctor talked about the second, common diseases that affect, the eyes. Mostly, we have seen young, old, youth. So who needs to be aware of this?
Okay, so
beginning with the one of the air pressure.
Yeah. Broadly speaking, eye conditions can happen to anyone. Okay.
Thank you.
But there are some people who are more at risk than others. And again, in each group, there are also diseases that are more common in that age group than another age group. Okay? Now, children are a special case. Children also have eye conditions that may be a bit different from the adult ones. Okay. For example, children also have NSNK, they have the cataracts as well. And for them, most times they are born with them. Immediately the child is born, the mother will see something like that in their eyes.
Yes.
And that can happen from genetic problems as the child was developing in the womb.
Okay.
It can happen from infections that the mother got while they were still pregnant, particularly rubella. Rubella, by the way, Because there was a time, I think 2-3 years ago, when there was a campaign to have people immunized, and people have this resistance towards immunization. Not realizing that these diseases actually cause a lot of problems.
Very true.
So rubella can cause cataracts in
babies.
The baby is born with a cataract. Okay, it's not the only one. There are others. We have a group of conditions that a mother can get infected with, and they end up having an impact on the what?
On the baby.
Yeah.
Okay.
Children also have refractive errors, the need for glasses. Okay, and unfortunately, because a child can't speak and doesn't know whether they can see clearly or not, the thing about children's vision is that the brain is still learning to see, and so if it doesn't get the right signal, it fails to learn to see properly, and that happens even more so if one eye is seeing better than the other. And so children's vision needs to be checked to make sure that the eyes are seeing appropriately for the age, to make sure that the power, because again, the power in a child's eye, remember the eye, when a baby is born, the eye is smaller than the adult eye.
Very
now,
true.
the power the eye has to focus the image it's seeing is higher.
It's very powerful.
Than the size of the eye as
very true.
To, okay?
Yes.
So what happens is that as the child grows, the eye is swelling, it eventually equalizes. But in that whole process, it may fail to equalize. And so children's refraction, we call it refraction, power in the eyes need to also be checked to see that it's appropriate for the age. Because if it's not, then as the brain is learning, it's not going to be able to learn to see properly. Okay. And what tends to happen is if one eye is better than the other, the brain starts to ignore the other eye. And that brings another problem. The eye starts to deviate. And
thank you. Zendali. Squints.
So, squints are quite common in children.
They are.
And most of squints are caused actually because of refractive errors. And frequently treatment for squints involves first checking the powers. If they need correction, correcting that, maintaining that, and sometimes it can resolve. We also do patching and all those things. And there's surgery available for squints as well. Okay. But those are children's conditions now. There's others, but those are the typical common ones.
Yes.
If a child don't need glasses, they must get them.
They must do.
Otherwise they'll get the secondary problems. Now, after the children's group, most of the other eye diseases tend to happen more in the elderly people. Okay? Cataracts are more common in people who are 50 years and above. I mean, even at 40, you may have some, but not yet bothering your vision. But from 50, every 10 years you add on, the more white the lens becomes. So the older you go, the higher the chance that you have a cataract, and especially one that is affecting your vision. When we talked about glaucoma, the risk factor for glaucoma starts from 40 years. Although some studies have shown that even as low as 35 years. So depending on the population, especially in Black Africans, we tend to get a more severe form of glaucoma, one that is harder to treat. And we also tend to get it a bit earlier. So 35 years and above, you start to have a risk for glaucoma. And the older you go, again, every 10 years you add on, the higher the risk. It compounds, in the background. Being black is a risk I've mentioned already. Then using steroids. I don't know if you understand what steroids are.
I know it in the other language, but I don't know which language you're using.
Steroids are drugs, and this is probably a problem more with health workers. Dexona, prednisolone, okay? Yes. In the eyes, Probeta. These are the drugs we have a lot in all our health facilities, and I'll use the word rampantly, okay?
Used, yes.
Those drugs, and again, especially in black people, we respond to those drugs, and therefore the risk factor for glaucoma increases, okay? So we are trying as much as possible as medical practitioners to reduce the usage of steroids, because they don't only affect the eyes, they affect other parts of the body as well. Yes. And for glaucoma, the risk factor in the eye, the closer you apply the steroid to the eye, the higher the risk. So if you're doing nasal sprays of steroids, the higher. If you're applying Probeta in the eye, the higher the risk of developing what? Glaucoma.
Glaucoma, yes.
Then of course, having refractive error is also a risk factor for developing glaucoma. So if you're either myopic or hypermetropic, or, okay, I'm using technical terms, but so the people who are more long-sighted, both groups, but the long-sighted people have another risk factor for a special type of glaucoma, which tends to present with pain. But if you need to use spectacles, again, just know that you have a higher risk of developing glaucoma. So those are the risk factors for these conditions that I've mentioned. Okay. When it comes to the other category of conditions, the itchy eyes, the risk factor for that anyone gets it anytime, but it has something to do with exposure.
Okay.
If you get exposed to some agents like dust, wind, and your body reacts towards those things. Allergies. If you already have a generally allergic body,
yes,
you will have those reactions more frequently than any other person. I think, yeah, broadly, those could be, I would say, the risk factors for eye diseases.
Thank you so much, Dr. Erima. Now that you've talked about, as for glaucoma, I'm speechless because it's something that has just caught my attention. But again, we shall always. It has.
I hope it catches everyone's attention.
It will. It will.
Must.
On this show, it does. But also, the fact that you've said it is painless.
Very.
I think it is important to do more screening. Don't wait for the day you get sick is when you should run to the, to the eye specialist. It's always important to have a weekly or monthly. How often should we go for eye checks as well?
Yeah, so that's a very good question. And I want to package that question with
how to prevent
eye disease, because I get asked that quite a lot. But Musawe, you get the really, of course, or to thesis how you speak in and what can we do to prevent this? And I usually tell people this. Aside from trauma, by trauma we mean like accidents, injury, direct injury to the eye, which can happen to anyone anytime.
Very true.
But of course, if you work in an occupation where you have a high risk of injury, maybe your metal works or in a factory, you're already at risk. You can avoid injury at those points by doing some things that is preventing, right? Wearing safety goggles. Apart from trauma and diabetes. Diabetes, you already have diabetes, you have your sugar controlled, you will control your risk factor for its complications. Okay?
Yes.
And there are things you can do to control the sugar and prevent yourself from having complications. But apart from those two conditions, you cannot prevent yourself from getting any eye condition. Okay?
You cannot
prevent yourself from getting any eye condition. Okay? That is primary prevention in medical terms. Primary prevention means that if I do these things, I will never catch this disease. If I sleep under a mosquito net, I will never catch malaria. Okay?
Yes.
If I kill all the mosquitoes, I will never get malaria. That is primary prevention.
Okay.
And we talk about secondary prevention, which means that if you do get this disease and you act early, you will not suffer from the complications of this disease. Just for malaria, if you get symptoms and you go to a health facility early, you will get treated quickly before you get convulsions from malaria. So secondary prevention for eye diseases is where we enter in. And the way you can do this is by having annual eye checkups. Annual. Our diseases are slow, they are painless, they give you enough time, and unfortunately people take all of this for granted.
Annual tegeza mwezi?
Once a year.
Once a year?
Yes, once a year.
The English are taking me.
Okay. All our diseases are slow, painless, they give you time. Most of them do give you time.
They do?
They do. But people take it for granted and are never bothered enough. Even when they start to see the chifu, they don't bother going to a health facility. They are waiting for a signal of pain, which unfortunately our most dangerous disease conditions do not cause. Okay? So we tell people that in order to prevent suffering eye diseases or eventually having blindness, make sure you get your eyes checked every single year. If you do that, when a disease is starting, whether it is glaucoma, whether it is diabetic retinopathy, whether it is Dansenke, we will tell you early and tell you the timing at the appropriate time when we need to intervene and do something for you. If we find you need glasses, you will get them. So just make sure you get one day in a year and you can attend an eye clinic and be seen by the right specialist, though.
Doctor, you've talked about squints and how kids as well get challenges of having eye problems in the long run. How can a parent tell that now my daughter, my son, has been watching TV from Monday to Monday, Nickelodeon, Bethany TV. My Bethany TV, we have those series that we switch on Chicago, and people are watching. They're like, my daughter is always on TV. But I think I need to take her to the eye specialist to check. So that's when they come in and tell that, because there are some kids who say, I always get headaches when I watch TV. I always get headaches when I read TV. Are those some of the signs as well? Because we need to also talk about the signs so that someone there can really detect as well.
Thank you for that question. The thing about It's interesting. And it's a very nice question. And a lot of people can relate to it.
Yes, I'm one of them.
Now, what I usually tell people is this. I compare your eyes to your legs. The function of the eyes
Yes.
is to see. And inherently, by definition, all it has to do is detect light. That's all it has to do. The brain actually is the one that sees.
Okay.
So the eye just captures light, puts it in the right place, sends the signal to the brain tells
The brain
this is what you're
stores
seeing.
and what you're seeing. Okay.
The brain interprets and everything.
Yes.
Now, you do not get an eye disease by using your eyes the way you're supposed to use them. Okay? Just like walking. You don't get leg diseases by walking.
Yeah.
Okay?
Okay, yes.
So when people talk about, I was watching too much TV, people restrict their children. You're watching too much
Wana raba
TV.
tabloids,
Watching too much tablet. Or also talk about things like, I've been using my phone too much, now I have got eye diseases
I sit
from
on
it.
the computer for 12 hours.
So you don't get eye diseases from using the eye for what it's supposed to do.
Oh.
All it's doing is sensing light.
Okay.
However, when you overuse it, it can get tired.
Excess.
And it will show that it is tired. It will, just like if you walk from here to Ginger, like the pilgrims do.
The pilgrims, yes.
Your legs will ache, won't they?
They will.
That is not a disease. It's just a temporary sign that you've overused this. And you will feel this thing yourself, which is the headache. It's the headache that you're feeling. You understand why it's coming. It's because you've overused it. Okay?
Yes.
And not everyone even gets them. Some people can watch something throughout and not have anything at all. So it also depends on your body, okay?
Okay.
But that is not a disease, okay? Now, we don't have the time to discuss it thoroughly, but there's something
We do have
between children using these tablets or doing crosswork and a relationship to how they develop the need for glasses, what we call myopia, short-sightedness.
Yes.
That the more they use the near things, the more they develop the short-sightedness. Okay. However, there's also an argument that they're using the near things because that is where their vision is accurate. Imagine a child who can't talk to you, but they understand that they can't see far things very well, so they can't play outside with their friends football. They get hit with the ball, they bump into people. But when they're in the house, they're able to arrange puzzles and see clearly in that area. They're able to watch things all the time. So that becomes a preference to them. It's not that causing the disease, but the problem is already there, and they're just responding to it in a behavioral change. It's a two-way thing, and there are lots of studies on that. I can't go into that right now. But if you notice a change in a child's behavior, as a parent, you really should respond to it. Get them evaluated and know what the truth is.
As kids are still in holidays, let's run to the eye specialist to detect these early disorders. We are still watching, you are still watching Health and Wellness on Bethany TV for Health. We are going to take a short commercial break and we'll be back.
Bethany TV for Health. The Health and Wellness Expo 2023. Burning those calories, staying rejuvenated and healthy. Happening on the 3rd of September 2023 at Hotel Africana. Adults, 35,000 shillings only. Children, 25,000 shillings only. By Dr. Vicky Indianabanji. Powered by Bethany TV for Health. Wake up to a healthy start every morning, burning those calories. Every Friday and Saturday morning, 5:30 a.m. with RCMA. It's the Body Hit here on Bethany TV for Health.
Even in rain time, it is not an excuse.
I
haven't been feeling well. My back became my back. I've been all over the place looking for treatment, spending huge amounts of money.
If you want to get proper knowledge about your health from experts, make sure you go to the Uganda Medical Expo. There will be over 60 experts and institutions in one place for 3 days, ready and willing to give medical information for free from the 7th to 9th September 2023 at Uma Showgrounds, Lugogo. Entrance is only 5,000 shillings. For more information, please call 0704 510 444 or 0783 529 804 or send us an email at info@medexpoafrica.com. Brought to you by Med Expo Africa Events, sponsored by Bethany TV. For health, growing and multiplying.
Father, we thank you that as we've master joined our faith on this earth, whatever
Touching those close and beyond, the Word of God ministered. Lives changed.
Our God made a way for the children of Israel and they made it to the promised land.
the day of salvation, and today is a day of freedom for you in Jesus' name. If you believe it, say amen.
We celebrate the resurrection because Jesus is alive.
It's a brand new day. Here we say it's a brand new day.
Never miss the Watuto Sunday service every Sunday, 10 to 11:30 a.m. live on Bethany TV. For health. The Higher Life, the era of the Word Revolution, with Apostle Dr. David Kunawa and Pastor Rita Bella Kunawa of Rivers of Life Assembly International, Boston, Massachusetts, USA. Streaming every Tuesday from 8 p.m. to 9 p.m. East African Standard Time with the incorruptible, incomparable, and revolutionizing life-transforming Word of God. Only on Bethany TV. For health. Introducing Bethany TV, the pioneer health and wellness channel in Uganda and Africa, having a profound commitment to health and wellness. Our content takes various forms, from music and series to documentaries, talk shows, news, features, movies, cartoons, and reality shows. We are a hybrid station available on free-to-air and pay platforms, embracing the digital age as we maintain a strong online presence through our website, social media platforms, and mobile apps. Explore our rich and diverse content, engage with us on social media, and be a part of the positive change we aim to bring to the health and wellness landscape. Bethany TV. For health. Bethany TV. For health.
Welcome back from that short commercial break. Health and Wellness on Bethany TV is here from 8 to 9 every single Saturday. Dorothy is my name. Today I do have an eye specialist all the way from Rubaga Hospital, Dr. Erima Dennis. And if you've just joined us, I don't know what to tell you, but guess what? You can go to our YouTube channel and you can watch the recap and get to understand how dangerous our eyes. You can also watch our repeat every Sunday at midday, on Bethany TV for health, so that you don't miss any show. Doctor, as we have talked about all this, we need to talk about the treatments. People say the money, but the money will always be there spent because we don't like screening, we don't like detecting these disorders earlier, because So briefly, in Uganda, are there special treatments for people that have such disorders in their eyesights?
Thank you very much, Dorothy. Now, when you talk about money, it could be one thing if they talked about access to care. If it's a money issue,
yes.
I can tell you, if you want to understand the cost of being blind, you can do it to yourself anytime. Even right now, the viewer, just blindfold yourself. Try to get up out of your chair and walk around the house. See what you can get done in the next 30 minutes with your
eyes closed.
Okay? And you find that you can't put a price to something like that.
Thank you.
Okay? Now, of course, it's true for many other health elements that you can't put a price to it.
Yes.
But I can tell you, I'd rather lose a leg than go blind.
Why aren't you, doctor?
I'd rather lose a what? A leg?
A foot.
Than go blind. Because there are other devices available that can help you manage movement.
True.
Whereas for your eyes,
you
will not have anything else that can help you manage vision. Okay? Having said that, and I know that was quite drastic.
It was.
We have eye care in Uganda. Unfortunately, we have very few eye health workers, broadly speaking, which means the issue of access becomes a bit contentious. We have about 5 categories of eye health workers.
Okay.
The first ones are opticians, who are really, it's hard to recognize them because they are in an unregulated segment. There is no certified training in Uganda, or well, I don't know anywhere, and they're not registered. So you can imagine that area.
Yes.
And they open optical shops.
Very many.
Which are businesses. Now, I would not like to talk against or isolate us, but these are facts.
Yes.
I'm speaking facts.
Yes.
Okay?
Yeah.
Now, we are, of course, right now, because I'm part of policy development, trying to work on ways to regulate them, get them into certified courses, so we can regularize the market and not have people walk into any spectacle shop and be fooled around, okay? But we have that card of health workers in Uganda. These are places where most people simply just go to get spectacles for whatever reason. Then we have what we call ophthalmic clinic officers. Now, these are usually clinic officers. We have cadre for clinic officers in Uganda, but these ones specialize in eye conditions. And most of them are linked to eye facilities. And in the government health system, they are linked to health center 4s, at the level of health center 4 and hospital. That means in health center 2, health center 3, you don't have any eye health cadre working there.
Okay.
So if you have an eye problem in a village anywhere, your thinking should be, let me go to health center
regional.
4. Go to health center 4.
Okay.
Hoping that your district did recruit an ophthalmic clinic officer in that center.
Okay.
Some districts don't have these workers there. They're quite few, but I think that government needs to put more effort in recruiting these people into those health centers. And our wananchi have access to eye care.
Okay.
Okay? I'd like to discuss the issue of access first. Now, the health center force should at least have an ophthalmic clinic officer. So these people study at a diploma level, and they know how to diagnose most eye conditions and how to treat most eye conditions. Then, the next cadre we have are the optometrists. Optometrists are a bit new in the field. I think their course in Makerere has now been running for about 5 years.
Okay.
So they probably have three people who have graduated in lots. Optometrists, people join the course from S6. They study for 4 years. They get a degree. And they can diagnose eye diseases and treat them. They also have a special emphasis on glasses, spectacles, refraction.
Okay.
And if you had to choose between the optician doing your glasses and the optometrists, you would pick the optometrists because they have a more intense level of study for these things. Okay. And they're fully regulated. And right now, there are programs there are plans to put them into government systems. I don't know what level they will enter at. Okay. But they will be able to provide spectacle services to most of the people. And in most health facilities which have eye care, they also have an optometrist in place. So we have an ophthalmic clinic officer, we have an optometrist. Then the next level is the ophthalmologist, which is now me and my colleagues. So our level, you first do a medical degree in general medicine. I practiced for, I think, 4 or 5 years, and then went for a master's for 3 years. So master's in eye, that is now ophthalmologist. And ophthalmologists are the eye specialists. They will diagnose eye conditions, treat them, and will also offer surgery. So any condition that requires surgery, as long as you have access to an eye specialist, they should be able to handle most of the common ones. That means that in saying case, the solid swellings, the things on top, they will do the surgeries for that. But there's a little more beyond that. After ophthalmologists, they what we call subspecialties. So we call super specialists in eye care. And they go into disease regions now. And you have a specialist for glaucoma, you can have a specialist for cornea, you can have a specialist for retina, which is the back of the eye. And of these specialists in Uganda, we have probably just one of each in the country. So one super specialist in all these areas.
Okay.
So there are some conditions when someone, if you see an eye specialist, tell you go to this facility.
Please go.
They are sending you there because they know that is the only specialist who's doing that in the whole country. Okay? Now, most eye specialists are located in the government structure in regional referral hospitals. So at the level of regional referral hospital, you get an eye specialist. You should get an eye specialist. Although again, not all the regional referrals have regional specialists.
Yes.
So these are the issues to do with access. Okay? When you say, if I have an eye problem, where can I go? Where will I get service? What services can I get? So I've explained the cadres to you, what you're able to access in each of the levels. I know there are private practices which may have all the cadres. I will not go into mentioning names, but I will unfortunately sneak in the fact that as Rubaga we have all these cadres available. But having said that, if you have an eye condition, the lowest level you can go to health center for, you should be able to find a clinic officer who can then, if he finds it's beyond him, defer you upwards to see an optometrist or to see an ophthalmologist. Okay. Now, treatment options. Most of our eye conditions, I said the most common eye condition actually is the one that requires glasses, spectacles. Now, spectacles, the field is dominated in Uganda by opticians. However, optometrists are coming in, and for me, they are a better group to help with those issues. And they do the refraction, and then they give you the right spectacles. They make and give you the right spectacles you need. Now, people have this phobia against spectacles. So you're wearing it when it's still too young. And I usually tell people, again, I like to use legs as an example so much. Spectacles are the crutches. Okay?
There's one needed.
Yes.
If that's the word.
Now, can crutches cause you a disease to your legs because you're using them?
No.
I mean, if they gave me crutches right now to walk without of it, I would walk. I could walk for the whole month with crutches. I don't need them.
Yes.
But I'm walking with what? With crutches. Okay?
To prevent
and I would not get a disease because I'm using the crutches. Now, if my leg was affected, if I had a problem with my leg, and I get crutches for that, it's helping me with mobility. What is wrong with that? Okay.
So the spectacles
help to project the light where it needs to go. That's all they do. Your eye has failed to put the light where it needs to go, so the spectacle directs the lights where it needs to go.
Okay.
And if you need it,
well and good.
That's it. There will be nothing more, nothing less.
Okay.
There is not, so that is the thing about spectacles, and they're quite common.
They are.
These conditions that require you to use spectacles are quite common. So you can access these services in many eye facilities. Even at the health center, for some of the ophthalmic clinic officers can do some of that refraction and give you glasses. Although better to start from hospital level above. But of course, government facilities don't provide spectacles. So most spectacles are being provided by private operators. Yes. But if you get tested by the right cadre, you'll get the right spectacles. Use them as recommended. Okay. Then we have eye drops. If you have eye diseases that require eye drops, we have plenty of eye drops in the market that can be prescribed at the discretion of the practitioner. That one is a practice element. I will not dwell so much on it. Whoever you see, if they determine that you require this kind of eye drop or the other, simply get them, use them as prescribed. But I want to caution that aside from glaucoma, we don't have very many eye conditions that require you to use eye drops for an extended period of time. The unfortunate thing how people do is when they get one eye drop today, they think that they're going to use it for the rest of, they're supposed to use it for it. In fact, they come back to clinics requesting for the same eye drop over and over, even when the disease they came for is not there.
We Google even.
Google. So things like conjunctivitis, which are so common,
yes,
only need about 1 to 2 weeks of treatment. The allergic reactions only need about 1 to 2 weeks of treatment. And the unfortunate is when you use it for such a long time, the eye drop also has complications. It eventually causes new eyes. So I expect that everyone who's watching this learns and knows that when they're given eye drops, it's usually for a short period of time to treat that specific condition. If it comes back again, you go back and see the clinician and get another group of eye drops. But don't keep on just because you got once. Okay? So eye drops are available for so many conditions. If it's glaucoma, the eye drops are lifelong, just as you take medicine for body pressure for the rest of your life.
Well, if you do have questions, our studio lines are open. Yes, so the doctor is here to definitely take up those questions, and our producer will be letting me know if any caller comes through. The number is 0786 050 762. 0786 050 762. It's under on our screen. Yes, you can continue.
Yes, so thank you. So the next level of care, I would have said, after we've done with the spectacles, eye drops, we move into surgeries. So some conditions require surgeries. And like I already mentioned, the cadre for surgeries are the eye specialist and above. Now, if
Uganda.
Yes, I'm seated right here.
Okay. My apologies.
Anyway, so things like Nsenke require surgery. There is no eye drop you can use for Nsenke. None. There are no glasses you can wear for it. It would require surgery. And we have
But it's treatable, right?
Yes, the surgery. Once we do the surgery, the next day, for me, I tend to give them the whole week. The next week, your eyes are seeing. For most people, the next day they're seeing better than they came in.
Okay.
Okay?
All right.
And it's possible for you to recover vision.
Okay.
Okay? Totally treatable.
Okay.
Totally treatable. So, eye surgeries are done by eye specialists. So, Nsenke, eyelid swellings, some other things I cannot mention because they are so technical to mention. But the surgeries are available at specialist level. And if the doctor tells you that your eye is going to require surgery, that is it. These surgeries are available in Uganda. Okay? However, there are some surgeries that are for super specialist level. The things like retina. And I said we have only 1 or 2 of them in Uganda. So those have special facilities. But you should have an eye specialist see you, define that this condition needs a surgery, and will tell you which specialist you need to meet to give you that special surgery, which is out of his skill level. Okay? We have a group of people who come to us and, you know, I've had an eye problem for a very long time. You should recommend me to go to surgery in India, Italy, Turkey, whatnot. We are here. Our specialists are here and can do these surgeries. But I can tell you honestly, there's barely any eye surgery that you can't find a specialist to do in Uganda right now.
Very true.
Okay?
Yes.
So the services are available. Good.
Yes.
I already addressed the issue of cost.
That one we have accepted.
I just want to mention one other thing about surgeries. People have a fear of surgery. Like, oh, when you go back home, you saw the doctor and they said, oh, that's what they say, right? That's one. Two, they also tell them, we don't do those things. We don't do those things.
Yes.
We offer the standard of care and the standard operating procedures that we follow for every procedure. And these things are available. You can even watch a surgery video on YouTube if you want to. Oh. Yes, you can watch an eye surgery on YouTube and see what is done for that specific condition. Okay. So people should not be afraid of surgeries. Wow. And I usually tell my patients, think about this. You've come to me, you're blind. Okay? I'm telling you, let's do this surgery. There's a 90 to 95% chance that you're going to see again. Right. The worst case scenario, 5%. Okay. If things went wrong, you're already not seeing. You understand? What is a 95% chance to you to see again? Again, I tell people, you know, close your eyes, stand up and try to do the things you're doing right now and see how
powerful it can change a bit.
Yes. Okay? So, people should not be afraid of surgeries. We don't remove anyone's eye out and replace. Now, there are conditions like trauma where the eye is totally destroyed, or like the infection has been so severe, the eye is totally destroyed and we have to remove it. That happens as well. For me, an eye which cannot see light for us is it's like a dead body. Okay? But we try as much as possible to keep it in. But if for any reason we have to remove it, now this is what shocked me. I learned recently that if we were to tell a person that your eye has to be removed, they tell you the explanation in Uganda. And I can do the removal, put in an artificial eye, which will maintain your cosmetic appearance. That is a prosthesis. But the local translation for that term is bagena kuteekamu eriso ly'endiga. That is the local translation for doing the surgery and putting in a prosthesis. You can clearly see how much work we have ahead of us.
No.
The local translation in Uganda is that, which is not accurate at all, and which means...
That's you can see on our screen how they removed. I think that's the cloud, right?
That one is well, more or less the same thing. We use similar instruments, but it's not quite that
Nera
loud.
balaga bazungu.
Yeah.
Producer, tulageko kuba na Uganda.
I will bring my
Please
videos
do.
next time. So,
Next time, yes.
as I was saying, we have a lot of work to change the mentality of our people to try and make it that they accept eye surgeries, because cataract is the leading cause of blindness.
Yes.
And therefore, the most advanced solution that is available to people is the surgery, which means, again, a lot of people need to get this surgery. But if we don't change their minds, they're going to remain blind in their homes. Okay?
Okay, doctor.
So that is the thing about surgery. No need to fear. And in any case, you're already blind. We are trying to bring you back. Why don't you take that chance? Why can't you take that
So,
chance?
disclaimer, the eye, that facial eye is not the eye of the sheep.
It is not.
Okay.
Much as the local translation defines it as such.
I wanted to be sure. Now,
Very.
now that you have cleared the air, what are the myths that you've had? I shared one before we started off the show, and you're like, you're two people that have told me about that. The twitching. It's sula. It's sula, I think, yes.
Perhaps it's a common thing. I did not know the term. It wasn't that common to me. Perhaps in the areas, it may vary from region to region.
Yes.
But eye twitching is not a disease condition. So
it is a blessing.
Their nerves, well, if you interpret it as such, there's no harm.
Okay.
But their nerves connected to parts of your body, and particularly the eyelid has nerves that are supplying muscles there, which move the eyelid. So sometimes these muscles misfire. When they do, because when it fires the muscle, when the nerve fires, the muscle reconstructs. So sometimes you may have episodes where there's some misfiring or random firing of these nerves, okay? It can happen anywhere. People even get it for fingers. You know, you can be there and your finger is twitching.
Yeah, okay.
It can happen, right? And the thing about those twitches is that the more you pay attention to it,
the more they become
it tends
true.
to happen, okay? So what I usually advise my people is that don't worry about it. Stop thinking about it. It will stop happening. Yeah.
All right.
But it's not really a harmful
You
thing.
could share with some myths you've experienced in the hospital as well, as a doctor.
So the other one was the one I've just talked about with the surgeries and the fear that we are going to put in eyes of whichever animal, which we don't quite do.
Okay.
Then there's also a fear of glasses. I think I also mentioned this, that people think so many things about glasses which are not, again, true. If you need them, use them. Then there's also this fear that is coming up with the usage of TVs, computers, and there's a lot of popular talk about blue light and blue light lenses.
Okay.
I repeat that the eyes, by looking at lights, is doing what, unless if you do two things. One, ultraviolet light is quite dangerous.
Okay.
But of course, most of our consumer items do not have the dangerous levels of ultraviolet light for you to get any disease from them. Okay. In fact, there's more ultraviolet light from the sunshine than any device that we use. Okay. But remember, you're walking around in sunshine. Now, of course, the UV light from sunshine is quite dangerous. And if you also stare directly at the sunshine, you know how bright the sunlight is, okay? Those things can injure your eye. Although even the injury from the sunlight tends to be a bit transient. But I don't like people going around thinking that the lights they're looking at are affecting their eyes. If you're having problems seeing things, it's because of a problem already with your eye, not because of what you're seeing causing the problem.
So people should continue watching TV?
People should watch TV. People should enjoy life. Yes. People should enjoy their lives.
So the computers should be also on? So
computers, again, I mentioned think about fatigue. Depending on your threshold, the longer you use an item and you feel strained by it, then change the timing, rest in between, do those behavioral things.
Walk a bit, leave the screen a bit.
Things, yes. It's not a disease that you can
never computer, not access. Again,
there's no problem. As long as you're not having any symptom from fatigue then.
Okay.
Yes.
There are people who look into a lot of light, especially camera people who see eclipse, and then before you know it, they get teary. Is it a disease as well?
Again, that is a sign your eye is showing you that you've either used it excessively or inappropriately. And as long as you stop doing that, the sign will go away.
So it's not a disease?
We don't categorize those things as disease.
As a disease? Yeah. Okay. And I have a TV doctor. Now I've come. now I've seen people that have 3 pairs of specs, and I'm like, are they rich? Or one for reading, one for driving, one chiller.
Yeah.
Do they differ? They vary? Are there those as
They
well?
do, and therefore exactly as the purposes as you described them. I can wear sunglasses anytime I'm walking around in sunshine. They won't have any power in them, but they'll be black to reduce the amount of sun glare that's going in my eyes. That has its purpose there. I can wear plain glasses just for style.
Okay.
Just because I want to look intelligent, I can wear plain glasses. And
that's why I hate people who wear specs. They be so much intelligent. They pretend.
Then I may have an error, like long-sightedness or social science, where I need to look far, and I need those glasses that help me see far. If I'm above 40, I will need glasses to help me see near things. And so I could have two separate pairs for that, but these days they can also combine them into one glass where you have a segmented bifocal lower down for near, upper is plain for you to see through, or has the power we need for that distance vision.
Okay.
Or you can do like our prestigious president, where he peeks over the other lens to see far, and then down to see the near
I'm
things.
telling you. Okay, now we got some few questions on air where someone was requesting for your number, but I believe he has said where you can find him. I think I wouldn't recommend.
No, it's I would not share my number, but I can always
But you know how to find us.
At Rubaga Hospital.
Rubaga Hospital.
Yes.
But also, if you didn't know, Dr. Dennis, we shall have him more and more. Yes, it is good news for me that anything connected to the eyes, we shall be having him. So don't be scared that when Dr. Tomorrow at midday, tune in and watch if you've missed this episode. Doctor, your last 2 minutes, remarks, just 2 seconds.
So first of all, I want to thank you for the time you've given me. I want to thank our viewers for staying on and paying attention. I hope that they've learned a thing or two. There's so much to discuss about eye care, and as you said, we will try and engage as much as possible.
Yes.
There's so much that has not been known about eyes and the diseases, because many people don't experience eye problems.
Yes.
But these diseases are there, and they tend to affect our elder people more. And these are our people who have the least means usually. You know, you think about your grandmother. Where is she? What is she doing? How are her eyes? And how much power does she have to access eye care?
Very true.
So we need to work so hard to engage the public so that we take more care of these people who are at risk. Nearly 50% of the eye diseases, the risk factor is being above 50 years of age. So most of the eye diseases tend to affect our elderly population who don't have the power to access or even afford services. So we are doing a lot of work in advocacy, trying as much as possible to revamp government systems to make sure that we give people access. In many districts where you have an ophthalmologist, they are working very hard in their area to make sure they bring in NGOs and projects to support eye care in the region. This is all the work we are doing to try and reduce the burden of avoidable blindness. And I can tell you one last thing. Losing eyesight, there are two forms. You can lose it suddenly, which is a crisis of its own. You can lose it gradually. But at the limit, when you've lost it, what tends to happen is, of course, you become economically non-functional. But not only that, you start to get stigmatized.
Very true.
And segregated.
Very true.
And studies even show that a blind person barely lives beyond 5 years more. Okay? So this is a very painful thing to see blind people, and especially when they're going blind from conditions that we are able to treat.
Okay.
So I would like people to take up eye services and embrace them and know that we're doing the best to provide for them.
Thank you so much, Dr. Dennis. If you do want to find again Dr. Dennis Eruma, that is Rubaga Hospital. Rubaga CNN one or Rubaga?
Yes, Rubaga Hospital.
It's only one.
Rubaga Hill.
Rubaga Hill, thank you. So if you want to meet him and have more talks with him, that's the only place you could go. Thank you so much for coming through, Dr. Dennis.
Thank you so much.
Hopefully to have you, I'll be having you more and more. That's a +1 for me. From Bethany TV to you, I would like to thank my producer. Thank you so much for creating time for this show. It has been an amazing show today. From me and Dr. Dennis, would like to wish you a good night. Bye.